Good afternoon, everyone. My name is Vin Go. I'm the mayor for this great city of Monterey Park. First off, thank you for being here today. Thank you for joining us in our 2025 Monterey Park Roundtable on Hope and Healing due to the tragic incident 2 years ago. So before I get started, I think some of you were here earlier, so you did a little networking, but we'll have more networking at the end of the session. We'll try to move this along because I know there's a lot of great ideas with our speakers, and we look toward and forward to a very viable discussion, collaboration, and what we can do next steps going forward. So with that said, let me just kind of share some of our local leaders here. So starting from our state senator's office, Sasha Perez. Our locally electeds from the City of Monterey Park, we have Mayor Pro Tem Elizabeth Yang. Council members Henry Lowe. Council members Jose Sanchez. Council member Thomas Wong. By the way, they're all mayors, so I just say council member to make it simple. And also our treasurer, Amy Lee. Also elected from the San Gabriel Water District is Mike Ng, former mayor, former assembly member. And I have a number of organizations here. Also from the Assemblyman's office, Mike Fong's office, Jennifer Tang. And Council member, former Mayor Adele Stratler from City of Alhambra. Okay, let me see here. Let me go through this list here. I have from the nonprofit sector, Community Friends, Peter Ng, CEO of Chinatown Service Center. Connie Chung Jo from CEO of Advancing Justice SoCal. Mia Porter from LA County Public Health. Dr. Sheila Wu, Director of Asian Pacific Counseling and Treatment Centers. And then from Tsuji Foundation USA, I have Sabrina Tam, who's here. And also from the Congresswoman's office, Congresswoman Chu's office, Gigi Lee, right? Okay. Let me see, I think I got everyone. The only person who I did not announce is Andrea Walsing, who is going to give us a presentation. So I will give a very brief overview, and then you can talk a little bit more about yourself. So Andrea Walsing has worked in public affairs for over 30 years. Part of her goal is to advance policies and practices that are grounded in equity, basically to prevent all forms of violence and to promote healing across all communities in LA County. Most recently, the department released a multi-point gun violence prevention platform to address gun violence impacting communities in Los Angeles County and across the United States. We've invited Andrea today to speak and share about the important work that the Office of Office Prevention does to highlight current initiatives and impactful programs addressing gun violence prevention and to share actionable steps for organizations to contribute to meaningful change. So she'll speak and then we'll have a collaboration discussion. So let's welcome Andrea.
Thank you very much, Mayor. And to all the elected officials and community partners and the OVP team who's here. We have Mia, but we also have Patty Hernandez in the back who leads our gun safety initiative, and Daniel Fong, who is one of our gun violence restraining order. I just want to say thank you for inviting us here tonight for this discussion on this really important issue. As you know, LA is set with a lot of challenge and the recent devastating fires. I want to acknowledge that, there are other things we're focused on, but together we really need to continue to stay focused on the issue of gun violence, particularly now. So I'm really pleased to be here tonight to share a little bit about the work of the Office of Violence Prevention and some of our initiatives, and certainly our gun violence prevention platform, in ways that we hope to partner with you. Just tonight being an opening door, a beginning, some connections that haven't been made, some connections that may have been made, but hopefully can be deepened as we fight together to prevent violence in LA County. So the mayor said over 30 years, gave age away, I think. But I have worked for a long time in public health and across a variety of initiatives. I've been with the Department of Public Health now for, it will be 12 years in April. Rejoined them in 2013 and worked as the director of the Injury and Violence Prevention Program. And then when this office was established, I became director of the Office of Violence Prevention. So happy to share a little bit with you. We always start in our office now, we always start our presentations with this content warning, because the presentation will contain data on violence and firearm violence in particular, and we will be having discussions around violence. And we know that impacts each of us in different ways on a personal level or a professional level, and we just want to invite you to take care as we go through the presentation, to pause and take care of yourself as you need to, both tonight and even beyond. So, first of all, about the office. Our office was established by the Board of Supervisors in 2019. After the Parkland shooting in 2018, there was, the board got together and said, we need to do something more. And so they asked our Injury and Violence Prevention Program to work with county partners and community partners to do an assessment to understand, was there a need for an Office of Violence Prevention, and if so, what role could it play? And acknowledging all the really good and long history of violence prevention work across multiple violence types of violence in LA County. And so we did that. We spent a year listening in various different local community meetings and listening sessions, talking to subject matter experts. We spent a whole year sitting with community to really understand the need for an office before the board officially established us in 2019 with a $3 million a year budget. Those partners helped inform our strategic plan, which is on our website, and helped us to come up with the vision for a violence-free LA County. That is our vision. We will always strive towards that in this huge county, and we do that through enhancing collaboration, coordination, partnerships, and building capacity across all of LA County, across multiple forms of violence. And we do that in concert, always working with those who are in the community, credible messengers, trusted messengers, community members who are most impacted by the violence, our county departments, mental health, social work, substance abuse prevention and control. We do it with our county partners and with our community partners. So we do our work using a public health approach, and just to briefly explain that, all the work that we do with our limited resources, we have an annual budget beyond the $3 million, but we still have limited resources in a county as large as LA County, over 10 million residents. So we always use the data to inform our work and our efforts. And I'm going to share some of that data with you in just a little bit. But the public health approach is to use data to understand the circumstances, the populations most impacted, where we need to target our resources while we still do overall work. It's based at population health, not individual health. It's comprehensive. It engages multiple sectors. It works to identify the risk factors for violence and identify what are protective factors to understand the cause and why people may go down that path, so we can try to stop violence more upstream, more at the root causes, while we still do intervention and we still do healing services. And then as we do these programs, as we pilot different efforts, then we evaluate those outcomes, and then we scale up accordingly. We always want to center the voices of those who are most impacted and survivors. We also don't want to exclude perpetrators or people who perpetrate harm, because we need to understand that too. We need to work with those populations as well. So that's sort of our approach. Some of our key initiatives that we have when we stood up this office back in 2019, and again, in coordination with our county and community partners, came up with 6 implementation priorities. One, in a county as large as LA, really wanted to do local and place-based work. You need to do local place-based work. Every community looks different, is informed by different factors, has different populations, has different needs. So our work is local and place-based. And so into our budget for the office, we put in money for regional violence prevention coalitions to be led by a lead agency in that community to work with partners or to understand what that landscape looks like, what were the priorities in terms of violence prevention, and who were the key partners at play, and how could you work with them to advance solutions. We also want to share the data that we have. We have access to a wide variety of data. We get the medical examiner data. We get death certificates. We get law enforcement data. We get hospitalization data. Part of what we really want to do is we use that data to inform our efforts, but we want to share that data with partners and communities and cities and counties so that it can inform others' work and you understand what we understand. And that's not all. You know, the numbers are one facet, right? We also pair our data in our open data portal, which we're just standing up now, and it is around firearm violence, and if you go to our website, you'll see it. But we did a wonderful, wonderful project, of which Mia is leading a second component, where we are collecting stories from those most impacted by violence across a wide variety of violence. So the first round we did this with the Department of Arts and Culture and an artist in residence, Olga Kumanduras. The second round, we're collecting more stories, but it's those stories that help inform our effort, those stories that are an important part of the data that we collect, because that's where you can really see the trajectory of violence across the lifespan, and you can see the intersection of multiple forms of violence. Sexual violence or domestic violence that started in the home at a very young age, and how that can lead to gun and gang violence and community violence later on down the line. So open data portal, it's going to have the data that we have access to. It's also going to highlight excerpts from these stories that we've collected. We have those books available, and if any of you want the books, or maybe Mia, we can bring over a collection of those books, 30 or so, for this group here, and and you're certainly, welcome to read through those and talk to Mia about that project. But open data portal, important to do that. We have a trauma prevention initiative that started even before the office was established, and I'm speeding it up a little because I realize I have a lot to say and I'm taking way too long. But that's focused on gun and gang violence in communities. It's working with credible messengers or those who may have been formerly gang affiliated or served time, who now want to do something different with their lives. And so they are the best to connect with others in the community that are at high risk. And so when an incident, a homicide occurs, or somebody shows up in the hospital, that trauma prevention initiative, they go and connect with somebody in the hospital, in the streets, to stop further violence. We have a crisis response pilot in South LA. Whenever an incident occurs, school shooting, mass shooting, school incident, high-profile suicide, homicide, we have a team that goes out and especially looks to the children who saw that violence and may have been impacted with violence. And we don't want to repeat those cycles, so we try to intervene early at that stage, and especially with children and young people. We have a trauma-informed care specialist, and we're lucky to have that. But we baked it into the office because where you have violence, you have trauma, and you need healing. And that's a process, and it takes time, but Hannah Denyer is our trauma-informed care specialist. She works, starting with our county departments, also works with community-based organizations, but does training and education around trauma-informed care. How can we as a county be better in terms of responding to individuals who've been impacted by violence and treat them in a trauma-informed way? And then last, we have a communication specialist, because we believe it's important to tell the narrative and shift the narrative around violence, what it is, how it occurs, the public health approach, et cetera. Those are our initial 6 implementation priorities. Since then, the board has given us additional ones, and we got $5 million in funding from the state to do a youth suicide prevention pilot that is as we speak, it's being implemented, and unfortunately it will end June 30th. But we are standing up a sexual assault council and a gender-based violence initiative, and there's more information. If you're interested, I'm happy to talk to you about that. But tonight, we really want to focus on gun violence, firearm violence. So I want to start us with the data and share the data. And just so you know, I'm happy to give these slides to Diana. I will send those to you so that you can distribute to the group, so you have access to all of these slides and you don't have to, you can write the notes. I like to write the notes, but I want to make sure that you have access to these slides. And again, a lot more on our website and a lot more data if you're interested. But we'll start here with looking at firearm mortality rates in the United States, Los Angeles County, in Los Angeles County. So these are United States, California, and Los Angeles County. And Los Angeles County is the green line, and the state of California is the red line, and the United States is the blue line. So the good news is we're way below those in terms of overall firearm mortality rates. We're below the US. We're about half, I think it's like 14 per 100,000 at the state level, and we're around 8.9 or 9 per 100,000 in Los Angeles County and California. And what you can see here is you can see the dip and then the increase a little bit during COVID, and I'm going to talk a little bit more about that right now. And so what we saw, so just so you know, for reference, firearm deaths include unintentional injuries, legal intervention, deaths at the hands of law enforcement, and injuries of undetermined intent. So that's what's reflected in these lines here. Firearm homicides increased 64% from 2019 to 2021. And the number of firearm suicide deaths, they did not increase that much from, they only increased slightly between 2019 and 2021. But you can see here that firearm homicide was the one that we're worried about. What we do see now are the numbers are coming down in 2023, so that's good. But still we're seeing increases in firearm violence, so more important than ever to renew our efforts. This slide just shows that violence in LA County, and firearm violence in particular, it affects all communities. It's pervasive, it's across all of the county. However, we know that certain populations are disproportionately impacted. And the suicide rate for older males, and older white males in particular, are almost twice as high as the county rate. And the high homicide rate for black, and these are black and brown men of color, are 3 times as high as the county rate. So when you have a county rate for homicide of 4.3, you can see here for black it's 17.2%, for Latinx it's 4.5%, for Asian it's 1%. Where you see dotted lines, the numbers are too small to report, so we're not able to report those. So again, violence is pervasive, firearm violence is pervasive. We know that it impacts certain communities and individuals more than others. When you look at firearm suicides and firearm homicides, those are the highest numbers, and we see those 2 populations are disproportionately impacted. And what we know too, and this is my last slide for this little set, is that deaths are the tip of the iceberg, right? For every death, you have many more hospitalizations due to firearm injuries. And so many more people in the hospital. For everybody who's in the hospital, you may have shots fired in community. Maybe nobody went to the hospital, maybe nobody died, but there were shots fired and there was an impact. For every individual who was injured or who was killed, then you have many more within that circle, friends and families, children who were impacted. So when you think of the numbers, and I show you those numbers, you think, oh, that's a huge impact. So how many deaths? 469 homicides, or so 200 suicides. But that is just the tip of the iceberg, really, when you talk about it. And when you look at the direct cost of firearm violence, actually in 2022, this is an older slide, this is older. In 2022, the direct cost of firearm violence is estimated to be more than $600 million. I want to talk for a minute about children because I think all of you probably were aware that, you know, there were a lot of reports in past years about children who were dying due to firearm violence and how it superseded all other causes of death, drownings and traffic injuries, right? So at a national level, children were dying from firearms at higher numbers than traffic deaths or from drownings. In LA County, that looks a little bit different. In LA County, the rate is far lower than that. These are the actual numbers from the years 2016 to 2022, the actual number of children 0 to 18 years of age who died in LA County due to a firearm. And you can see here again, the numbers during the COVID pandemic were increasing to a top high of 51. They started to come down in 2022. I think our provisional data for 2023 shows those numbers going back up. So we are lower than national rates. At the same time, any death, this is a preventable death. I believe that most violence is preventable, but this is a preventable death, and we can all play a part in making sure that those numbers drop down to close to zero, if not actually zero. And this is how. This is how, and this is the essence of our conversation here tonight, because the Pew Research Center, when they were looking at gun safety and gun safety measures, this is where I think we have some work to do. 64% of U.S. gun owners fail to keep their guns in a locked place. 64%. 56% of U.S. gun owners keep their guns loaded, so locked and probably unloaded. About 40% of all U.S. gun owners report having a gun in the house that is both loaded and easily accessible. About 30% of gun owners with children under 18 report having a gun in the house that is both loaded and easily accessible. 26% of gun owners with children report advising visitors with children that there are guns in the house. So a gun owner with a gun in the house with children and children coming over to play. 26%, a quarter of those about, let somebody know that they have guns in the house. 74% do not. So I think there's a lot of opportunity there. There's no blame and there's no pointing. I think for public health, what we're really about is safety. So we know that there are guns. There's a plethora of guns in our society in the United States and in LA County. So how do we work together, gun owners and non-gun owners, to make sure that if we do have guns, that they're safe, and especially safe around children. This is just another slide outlining some of the costs that I mentioned earlier, the $600 million, and this talks about in 2022 there were 542 firearm homicides and 626 firearm assaults treated in hospitals. So the costs are huge, and I think the investment needs to be, if not on par, which it probably will never be, then there can be room for more investment in making sure that we do all that we can do to make sure that gun violence is prevented. This slide just lets you know that we have a wonderful data package that's broken down by geography, by SPA, and if any of you are interested, you certainly can have access to it. And we would be happy if you contact us, and there will be information at the end. We'll be happy to send it to you. So let me talk about the gun violence prevention platform. So in 2022, and I just want to keep my eye on the time, in 2022, and you can tell me when I am running close to out of time, but in 2022, right after Uvalde, Texas, and Buffalo, New York, and those mass shootings there, and little did we know that Monterey Park would come soon after, our county leadership, our board of supervisors, and our director, Dr. Barbara Ferrer, said it has to be something more that we need to do. There's more that we can do. So great initiatives, great strategies, great programs that you're running, Andrea, but what more can we do to stop gun violence? So we pulled together those county and community partners. They're our governance structure, they're who guide our work, but we even broadened the circle, and we invited a broad group to that table and said, what are the strategies that we could do to prevent gun violence? And that group came up with the 40-point gun violence prevention strategy platform that you have, or you have access to, and they helped us to prioritize 4 areas where we should dive in the next 5 years. And those include these 4. Advocate for robust gun safety legislation locally and nationally, including the federal ban on assault weapons and large capacity magazines. Do that advocacy, get people engaged, expand the civic effort, raise awareness so that people know what to do and how they can play a part. Promote social connections and healing and a culture of peace. So how can we very much at a local level, as well as communicate and message countywide about a culture of peace, and what does that look like, and how do we create safe spaces and healing spaces in community, especially after a violent incident occurs, so that people have a chance and an opportunity to heal from that, including our young people. And so how do we create those spaces to heal? Healing and trauma-informed care, as we say in our office, is violence prevention. Improve access to restraining orders. And so we have, the board stood up our gun violence restraining order. They gave us a budget, very fortunately, and we have 2 system navigators. Daniel Fong is one, William Ortega is the other. So there's a law, that law about gun violence restraining orders was passed in 2014 and became effective in January 2016. What they found were very few people were using those restraining orders. They weren't. Law enforcement was using them, but the legislation gave broader access to others to call for, petition for gun violence restraining orders, and it wasn't happening. And so our board said, here are the resources. Elevate awareness about gun violence restraining orders, but we not only elevate awareness through campaigns, which is an important part, and I'll talk a little bit more about our gun violence restraining work in a minute, but that's a hard system to navigate. So if you tell people this is available as a tool and you can use it, but they don't know how, or it becomes intimidating, or they run into challenges and barriers when they go to the courts, then that's not going to be a tool that's used. So we felt really important, and we were glad that we are able to have staff that can help people not only understand about gun violence restraining orders, but navigate that system should they choose to use it. And then the last priority in that gun violence prevention platform, and you'll see 40 points, 40 strategies in there. We had to pick, where do we begin? Where do we start? How do we supplement and complement our current work? And the last one was really to focus on our young people and focus in schools. And so we have $5 million that we gave away in school safety transformation grants, and we work with a local CBO and 5 school districts to really say, how can we create more supportive environments on the campus? How can we increase safe passages in neighborhoods where children can't even walk to school without seeing some type of violence in their way? So that was our 4th priority, and those are the ones. And we have a bunch of different activities that we do in each of these 4 areas, but we want to ever expand the circle of people who are engaged with us, and we engage with them to implement and focus on these 4 priorities, believing they can really help us turn the page. This is just when we first started, and we had a very good communications team, including graphic designers. So we have T-shirts, we have pledge cards, we have buttons. You can have access, anything that we have, we want to share with you. We are your Office of Violence Prevention. We are your Department of Public Health. So any resource that we have is available to you. And what we center, and here in the middle is what you see are two of the storytellers with quotes from those storytellers. So if you look at that book, and again, we collected 100 stories the first time around, 40 the second time around. The book only contains 33, otherwise it'd be a massive, massive volume, and we will come out with a volume 2, but these are quotes from the storytellers. So let me talk about, really quickly, let me highlight 2 of the really important points of our strategies of our gun violence prevention platform, and these came in subsequent board motions and with some funding to do this work, and we're really lucky to partner. So on our gun safety initiative, and here, really, this gun safety initiative, and Patty Hernandez is the lead of it. She does this work beautifully. She is your point of contact for this, is to distribute. So she's working with our Department of Health Services, 6 medical centers, with our LA County libraries, and with other partners. We have partnered with LA Care. We partnered with LA Care and LACMA, Los Angeles County Medical Association, to do a billboard campaign. There are others. We are contracted agencies with community partners that we meet with other healthcare providers. We'll want to partner with anyone who is interested in helping us to distribute these gun safety locks and gun safety educational materials. So there's a lot of tools and resources on our website that you can have access to. We will give those. We want people to ask for those. So there are 2 free gun locks that you can go to our website and you can order them free, no questions asked. We want to make this as easy as possible. We want people to lock up their guns and keep them locked and unloaded. And so we have the website, we have the partnerships with, a variety of different partners, and Patty's ever expanding that group of partners. We've distributed in LA County since we started this initiative, and I think it kicked off in April 2023, 2024. So 2024, 22,000 gun locks have been distributed, and we have 60,000 gun locks that we'd like to see distributed by June. And so please, again, if you're interested or you know of groups or you have events or healthcare or you want those locks, you can always contact Patty. But this initiative is really about increasing education and awareness and distributing those gun locks and distributing materials and just really pushing for gun safe storage. And then at the same time, as we're able to, and really Mia is so gifted in this area, she's been an advocate for Moms Demand Action forever, to really help us understand too the policy landscape and how we can get people more civically engaged in helping to advocate for gun safety. So that's one part of it. And then we have our gun violence restraining orders. This is the other second highlight. This is the last highlight I'll do here. And this is gun violence restraining orders, we know, can be helpful if a person who has access to guns is in crisis and showing signs that they might hurt themselves or others. And I want to say this because I think this is truly, truly important. I believe, especially in mass shootings, when individuals do that kind of a rampage, there were probably signs long time before. There were probably things that they said, things that they did, people who they talked to. And law enforcement is amazing, and yet they might not have access to that. Friends and families do. So community-based service providers do. So it's important for all of us, as the gun violence restraining orders gave access to a broader pool of people to petition for a gun violence restraining order, and law enforcement is involved in that we do that. When people see things and hear things, that they think about gun violence restraining orders as a tool, because gun violence restraining orders can stop someone from having, owning, or buying firearms, firearm parts, ammunition, or magazines. And these can be obtained by police, law enforcement, of course, family members and partners, housemates, employers, co-workers, and school officials. So that is a broad pool of people who might come into contact with an individual who might be exhibiting some signs or symptoms or showing that they might be, that they have a gun, or that they might use a gun to harm themselves or to harm others. So for both those incidents, in case of suicide, if someone knows of a family member who may be suicidal, if there's someone in community who is showing signs that might need help, it is the people in community that are going to see that first and know that first. And the gun violence restraining order removes guns and ammunition for 21 days and up to 5 years from individuals who are at high risk of harming themselves or others. But it's a process. There's an opportunity for people to go to court and say, no, I don't need to, my gun shouldn't be taken away. So there's a process. It's not a without, but I think it's an important tool that has been underused, and we're happy now to have some resources to help provide support around that. We have flyers and we have posters that are available that you can get from us free of charge. The system navigators, as I mentioned, and Daniel's here, and if you want to talk to him or if there's more information. And we also advertise the gun violence restraining order, access to support through our public health info line. The last thing I want to mention is the trauma-informed care resources are really important. We're fortunate to have Hannah there to help us develop these resources. And it was in 2023, after the mass shooting in Monterey Park, that these materials were developed. Public health wanted to do something. Dr. Barbara Ferrer wanted to do something. I know the Office of Emergency Management was on the scene along with DMH, but that's when we developed these materials of how to talk to your children. What are trauma-informed resources? What does that response look like? What can you do? And these are available in multiple languages, and I think Patty brought some of them for you here tonight. And then Hannah is available if you're interested more in trauma-informed care or how to do training for your staff or any of that. She's happy to connect with you. So my last plea as we, to get us off into discussion, just thinking about some ways in which we might partner. And again, we are here to provide support in whatever way that we can, through staff, through resources, through education, through training, through data that we have. But please join with us, or we can join with you in raising awareness about firearm violence. It could be hosting events, it could be distributing flyers and materials, posting on social media and writing letters. We're happy to be your partners with that. Help us to engage other in the healthcare system. So we're making those connections now, and I'm really happy that they're expanding. But individuals, providers, and communities, those are the ones who see a lot. Pediatricians, if you know pediatricians, they can talk about gun-safe storage. I think there's an opportunity to expand our network of healthcare providers who are engaged in this, who get training, who have access to gun safety locks. So please, if you know of academic institutions or healthcare providers or systems or others to train, we're happy to do that. It starts with us, with each of us, and talking to our family and to our friends, and just to be aware of signs or symptoms, or what are the resources that are available if someone's in need or in crisis. And our website and our office has access to a lot of those resources that you can have if you don't have others. And then we ask people to take a pledge to stop gun violence. And we have pledge cards to do that, but I think just a commitment can be made. And you are leaders, and you have access to constituents and people. And so I think, too, if you through your leadership, we could expand our efforts considerably. And we can help to expand your efforts as you do this work and as you care about this issue. And then these were just some other ways. And this is mostly about our website, which is there to scan. But get the data. If you're interested in more data, or you want to talk to any of our epidemiologists and to understand more concretely, law enforcement is a great source of data, and we do get our data from law enforcement. But and I keep pointing to FIDE. fire, but he's right next to law enforcement. You can contact us for more data. We're happy to talk to you about what it looks like in your area, or data that might be missing, or data that we might have. We have a monthly newsletter and ways to get involved or connect to different efforts. We have local efforts in 9 communities. They're targeted mostly in 9 communities that we've identified with the highest rates of violence, but we have a lot of local leaders that we're connected to. And we want to hear if you have local efforts that we should know about and elevate. And then, share your events. We're happy to come, and please, we're happy to provide gun safety locks or materials, educational materials. And we're really open to hearing if there are things that we should be doing as an office that we could be doing. So you tell us, how we can be of help to you and to others. And that concludes my presentation, and open for questions or discussion now.
I'll help you.
Okay.
The City of Alhambra has a business called, let me start with this. I'm interested in finding out which school districts are under the Comprehensive School Safety Initiative. That would be something that maybe that's on your website so I can research that. And I wonder if you have any data on the use of the types of businesses that may encourage gun use. And I ask you that because I'm just going to tell you straight out, the City of Alhambra has a soft air gun business. It's massive. These guys know it. It's massive. And it has people going in, and they're training to shoot, and they're training to, and I'm just making a big assumption here that they're taking care of business with respect to how they utilize it, how they teach, how they train, and then they have to go out to these centers to do that, or out into the, the woods or whatever you want to call them. I'm wondering if you guys, because City Council folks, we jump into the fire all the time. So we walk into where wolves are, right? We figure out where the problems are, where the gaps are, and I'm wondering if you guys have something in your program or whatever, your goals, that look not maybe just to this kind of a business, but something similar to it, maybe on a smaller scale that people are doing, and provide that information, the exact information that you give to us on a obviously, one pager or whatever, that everybody who walks into either a gun store, even a Big Five, right? They sell them too. But they have some sort of education material that they have to provide whoever buys the gun or who's ever playing guns, right? I mean, they do it for online. I understand that hopefully our families are watching what our kids are watching online when they play these games, and I know there's some things, but really being part of that, I think that really has to happen to a lot of these businesses that, don't look the other way or don't realize the ramifications or the implications of it. Thank you.
Thank you, Adele. And I'm happy to, that next slide has my information, but I can send you the school safety information. It is on our website. Happy to send it to you if I can get your information before I leave here. We are in the City of Alhambra. We're on 1000 Fremont. That's where we are located. And so we're in your city. But to your other point, so we actually, William and Daniel, I don't know if you got engaged into it, but we are looking at all firearm dealers in LA County. And we submitted an IRB, so to do some research, to reach out to those firearm dealers, to ask them if they actually would safely store guns, because with gun violence restraining orders, you either give up that gun to the precinct or you can take it to a shop that might store that safely for you while you're in crisis. So we're in the process of calling up every firearm dealer. What you're talking about sounds like a little bit of a different business, but I agree with you 100%. And it is an opportunity. I mean, anywhere where there's guns available or guns, we should have gun safety, because that's what it's about. We're not taking away gun rights or gun owners' rights, but we are about how do we collectively work towards safety. And I think we're happy as we are able to.
And if you want to share with us or with Daniel, you know, the name of that, the specific name of the business, I mean, we will do the outreach.
Right next door to you.
What is it? Oh, Kohl's?
It's right behind Kohl's.
Oh, you mean
it's
EVIC.
behind Kohl's.
You're talking about EVIC, right?
Yeah.
Yes.
It's airsoft.
Oh,
So,
Airsoft. Okay, Airsoft is the name of the business.
EVIC, E-V-I-K-E.
EVIKE. Okay, Daniel, I think it's taking notes. We will reach out and we will attempt that. And then I think there is something about the broader culture of our gun violence, and I think there's even a role for Hollywood and others to play a part in this. But I think starting with the firearm dealers and those who are.
yeah, so I think the key here is communication and also educational, because if you think about 40% of gun owners, 40% of them are loaded and accessible. Accessible is the key here, because if there's children, that should not be accessible, and it's educational. I think, Thomas, you have a question?
Thank you. Andrew, thank you so much for presenting this information. My understanding is that Board of Supervisors did approve some funding for a GVRO kind of outreach campaign or some sort of advertising campaign. I'm just wondering if you could talk a little about that. And then great to hear that there are resources to help people navigate the process of obtaining a GVRO that's accessible to any resident, sounds like, in LA County. And the challenges we're talking about is a lot of people don't know that exists or that they can exercise that option. And kind of putting those together, if you could talk about the state of the campaign or the status of this to help get the word out about GVROs as an opportunity for people to be able to exercise, and how do we do a better job of that? And I know Advancing Justice, AJ SoCal, and Sierra Childhood Service Center, and other CBOs would be great partners to make sure that this information gets out, if it's not already translated to some of the API languages, to help get this, do that translation work, and then help get this word out to communities that need it. And particularly thinking in specific terms about what could have prevented this incident here at Monterey Park. Right there were family members and others that knew that the shooter was having some issues, and I think potentially access to GVROs and knowing that this was not a tool that they could exercise, maybe could have done something like this or other tragedies like this where mental health is an issue, part of the shooting or the kind of motivation of the shooting.
No, thank you, Thomas. And you saw the budget. It sounds like you read that board motion, and we're grateful. So we had a first campaign, the GVRO, and you saw some of the posters highlighted in the PowerPoint. And they were translated into multiple languages. Patty, do you know which languages that they, I know, of course, English and Spanish, but were they translated into any?
Off the top of my head, if we had it translated into Asian languages, probably would be traditional Chinese, where we had those GVRO billboards. But that was that first campaign. Our marketing materials, so our posters, do come in traditional Chinese. We have a PSA, also an animated PSA that we are looking to launch and roll out with our partners on our website, et cetera. That comes in simplified and traditional Chinese language. So we are working to kind of continue to expand the awareness campaign of GVROs. But in the meantime, we have Daniel and William Ortega, who's not with us today, who go out to communities, speak to different constituents about the GVROs and what we are doing with them in the office. Because, as to Andrea's point, law enforcement uses them and they're good at using them, but community doesn't know how to use them, even if they know that they exist for them to use them. So that's part of our awareness campaign as well. Moving forward, when we do expand a second rollout of the campaign materials, we'll be sure to inform and advise and maybe even check in with you all to make sure that it lands correctly with the different communities that we all serve.
And I see Daniel wants to say something. And so I think, Thomas, that the part of the answer that Daniel's going to provide, there is more funding. So the first campaign was funded by Public Health First Funds. And we worked with our DPH Comms team and Team Friday to do that first campaign. there's definitely room to translate into additional languages. Again, I think there's opportunity to check in, like, how do we prioritize? Because they ask, okay, there's so many languages, what do you want to do next? And so I think there's opportunity to understand what some of those other languages are. But there will be a second rollout. There are additional funds in the budget, and we will use them to do a second wave of that campaign that hopefully expands. Because I think you're absolutely right. If someone in Hemet, because I think the gentleman moved to Hemet, was here but then moved, you know, if more people knew and this was broad in language and put up where you could see it everywhere or just in common places, then someone might have seen that and said, oh, maybe I can use that as a tool. I think it's a combination. Daniel, I'm sorry, I didn't mean to.
No, thank you. Really great information. Just wanted to add, as well as the awareness campaign, we are currently reaching out to all law enforcement agencies around LA County, doing specifically GVRO trainings with those offices. We have about 8 of them currently scheduled for the next month and a half, and we are pending another 20 presentations as well. Additionally, from law enforcement, we are also presenting to different county departments, like the Department of Mental Health. We're also presenting to service area leadership teams throughout all of LA County. So we are doing what we can to hopefully get this awareness campaign off the ground and just letting folks know that this is a tool that they can use. Might not be the right tool, but it's a tool that's available. And you know, we are at a lot of community events as well. So if there's anything you all think of, any events coming up, anywhere that you think, you know, awareness can be spread at, please share that with us and we'll be there.
Yeah. I mean, tell us like who else we should be talking to. We're starting with law enforcement and county departments, but that's kind of internal. So if there are other external groups and community places where we should be showing up or doing these presentations, but that's also where we're trying to engage healthcare providers because they're critical, mental health providers, the physicians, they also would be good advocates in this space, but let us know, just tell us, here's some languages, we'd love to see these in, and here's some opportunities, and here's some populations you should.
Chief has a.
Yeah, so we got ahead of this before the county started doing the training. We sent our personnel to San Diego and got involved in their regional training. So we have detectives, records personnel, and the city attorney's office is fully up to speed on GVROs. We have a link on our website to the county's GVR process because the forms in LA County deal with the court. So we use the county forms, but we have all of our personnel are trained on that. We have yet to have anybody request one, but our police department's fully up to speed on GVROs at this point. We have been for quite a while.
That's really good to hear. And San Diego, they are the best
Yeah,
trainers, right?
we sent people down south for the training when they were doing it regionally, when they had the grant still.
Right.
So we took advantage of the
And they
grant.
did a lot of training, and they're very good at the
Yes.
GVROs. And
Yeah.
so I think our efforts are to, you know, wherever we can,
Yep.
expand that training and education, certainly not where it's already been done, but.
I mean, we use restraining orders and we use court orders on a regular basis to take firearms and make people ineligible for firearm purchases or owning. So we can cover a lot of the issues, but we don't have contact with everybody in the community, and that's where this kind of fills the gap. If we come across somebody who's having mental health crisis, it's part of our procedure to determine if they have firearms and to remove those from their custody. So we do that on a regular basis. But it's the people we don't come in contact with that we have no way of knowing if they're in crisis unless someone in their immediate circle lets us know. And then we may be able to use our law enforcement abilities to remove those firearms, and they may not have to go through the GVRO, because then you're dealing with this stigma within that family about dad taking guns away from son or son taking guns away from dad. And so some people like that anonymity of having law enforcement do that.
Right. We heard that a lot. People were afraid about doing that because that is their family, and would they know, and you know, and what that would do to that dynamic. So, well, we could learn from you. I mean, if you're a law enforcement example of a law enforcement that are doing that and has that information, I hope we can come to you too and learn from you. And as we continue our expanded outreach to law enforcement, maybe you're an example or a model of how you post it up or do the work that you do.
It's a great program. We're happy with it. We're just waiting. People, you know.
Yeah.
Okay, so I'm getting the hook on time, so we're gonna go Jennifer, one quick one,
Yes,
and then we'll wrap it
I
up.
just wanted to add to the GVRO discussion. Following the incident in 2023, Assemblymember Fong secured $4 million in the state budget that year to translate materials on GVROs into the top 10 most common languages across the state other than English. And so that, Scott went through the Office of Emergency Management into a public, a PR campaign to get materials out there. So adding to all the work, the great work the county is doing across the state, we secured resources to expand that access as well.
Great. That's a great plug, and we all love Assemblymember Fong because we know what he's done in the last 2 years. So I'm just going to do a quick wrap up. I know we have nonprofit groups here who are really, really great in what they do for our community, with the Hope Resiliency Center, with the counseling and the mental well-being, mental health that they've been doing the last 2+ years. And that really is the healing part of it. But if I looked at the definition earlier that Andrea presented, was violence, trauma, healing. We got the healing part of it down. We need to kind of work this thing backwards. Let's get the violence down, which really is the prevention, which you talked about. And another part of that is the outreach. So let's work with Andrea. Let's figure out what we can do from an outreach standpoint so that, we all learn lessons in life. But I always say, I'd rather not learn the lesson the hard way. Let's learn the lessons from other people's mistakes first, and then work around it. So that's where the outreach comes in. Let's continue this dialogue. This doesn't end today. Tomorrow, 10 years from now, I have a feeling this is beyond my lifetime. Continue the dialogue, collaboration with Andrea, with the county, with everyone who's here. Explore opportunities on what we can do to improve, really, public health for our community in the U.S. With that said, I want to thank city staff, the 2 chiefs who are sitting there, city manager's office, Inez, Diana, and Diana, librarian, Parks and Rec. You guys did a good job putting this together. We're only a component of this is done. We have a bigger event outside the City Hall lawn in about an hour. So we're going to adjourn this meeting. This room will continue to be here so you guys can continue to have discussions and dialogue. So thank you for your time, your involvement, and on behalf of the city, thank you for all the work that you've done to make this community safer and better.